What is your impression of this AIDS conference now finished in Washington, D.C.?
It was a very interesting gathering. I think it also was a very important gathering because it was a collective feeling of we can move forward, we can actually really stop AIDS, we can bring an end to the epidemic. We still have a long way to go, but it is important that we see a purpose, that we know, that we see why we are doing this. And I think that was certainly a message that came through in this conference.
What is happening with the epidemic right now? Where is it going?
There's 34 million people living with HIV. The number of new infections globally have come down. We have now estimating that 2.5 million people have become newly infected with HIV in 2011, which is a little less than we had in the years before. So that in general is good news. However, we have areas, especially in Eastern Europe, Central Asia and the Middle East, where we see increasing epidemics. That's of course a reason for great concern. That should not happen, and it's an example that we don't really focus on the right things yet, at least not in these regions, to really stop the spread of HIV.
How can you separate this epidemic into different entities? You know, if you describe the epidemic, the character of the epidemic.
There's very different types of the epidemic. We have epidemics that are mainly driven by so-called key populations. Some countries is mainly injecting drug use. In other countries is men having sex with men, sex workers. And they are very different, of course, in terms of their spread, but also in terms of the response to the epidemics that we mainly see in Africa, where there's the general population, where HIV is spreading quite dramatically in many places, especially in South and Eastern Africa, where we have infection rates still even in young people, of 10, 15, 20% in some places. In the cities, even more. In the urban areas, it's even higher in some places. That, of course, is still shocking, and we have to really find better ways of stopping the spread there.
What is the most important lessons that you have learned at this conference?
The most important lesson is that we feel that we have a tool set that, if applied right, we can really make a massive difference. Over the last 12, 18 months, we have seen very important evidence that the good use, a strategic use of antiretrovirals can not only save lives of people, but also can have a very significant impact on the spread of HIV, on the transmission of the virus. And we now have to apply this potential in better ways. That means, one, we have to treat people earlier. Right now, the majority of people who are given the antiretrovirals start that when they're very sick still, especially in the poor countries. And in Africa, they're well below a CD4 count of 200 when they're really sick. That, of course, it's good that they get it, and it prolongs their life. I mean, they stay alive, they stay productive or become healthy again. But it doesn't really capitalize on the prevention benefit of treatment enough, because of course the transmission happens before people really get sick and then come to the hospitals.
What do you expect? What kind of development do you expect looking at the epidemic between Washington and the next AIDS conference in Melbourne 2014?
I think it's now really a question of how do we do it. This conference, I think, came no, let me start again. I think it's really now the question of getting together, taking the right decisions, and making a plan on how we really move on the path towards the end of AIDS. This conference, I think, came together to agree that there's real hope, that we have the instruments, that we can do it, that we can overcome the epidemic, but we still have a long way to go. That's the point. And I had a number of discussions with leaders who have been here at the conference, who share sort of the concern that let's not just have this as a festival, as a praise of what we have achieved, and then go home and forget about it. It's now the time to really get together and develop the plans that bring us to the end.
What role has UNAIDS in this?
UNAIDS is the global leader in terms of policy but also advocacy that brings together the different, not only organizations in the United Nations, but also works very closely, of course, with member states and activists and civil society to bring together the knowledge, to provide the information, to generate energy behind the AIDS response, but also energy behind, for example, financing. We need more money, and that certainly is one of our major tasks for the coming years, especially in this environment of sort of scarce and more scarce resources. We cannot stop now.
You have been very early on active in fighting HIV and AIDS since Germany in 1985. How important is it to understand the history of HIV and AIDS?
For me personally, it's very, very important. I've been a doctor in one of the first clinics probably in Europe. I've seen many patients myself. I've seen friends die. And that alone is something that will never leave me and that will keep me on my toes. We have a different situation today, of course. I mean, we have very good tools. We have the pills that really are brilliant and keep people alive and productive, and we don't see people die anymore, at least in our countries. But we should never forget why we are here. Clearly, having seen through the whole history the human rights aspects, even in our own countries, that now I see again and again and again being discussed in other places as well, it does help me. It does help me personally. It does help me also within my work at UNAIDS to never lose the perspective.